Well, good afternoon, good evening, everyone. Thank you for joining us for today's PATH Live Forum in conversation with two of Washington State's great leaders. We have today with us Congresswoman Pramila Jayapal and Washington State Secretary of Health, Dr. Umar Shah. I'm Nikolai Gilbert. I'm the President and CEO of PATH, and it's my great pleasure to welcome you to today's events. I see, and we can see from all the people who signed up to join, we have more than 400 people signed up for the event, and they're joining us from all around the state of Washington, from the US and from around the world. With us, we have government representatives, we have community organizations, NGOs, donors, private sector partners, and others. Thank you for joining and spending the time with us the next hour. We want this to be as informal and interesting and fun as possible, so please do engage with us throughout today's discussion by sending your questions and comments to the Zoom chat, and we will be monitoring this chat and also saving time for questions later in the hour. I'd like to start by introducing my two fellow speakers today. I'm very happy to be with them. It's a great honor. So we have with us Congresswoman Pramila Jayapal, and she's now serving her third term in Congress, representing Washington's 7th district, which encompasses most of Seattle and its surrounding areas. Prior to serving in elected office, she spent 20 years working internationally and domestically in global public health and development as an award-winning national advocate for women's, immigrants, civil, and human rights. We also have with us Dr. Umar Shah, who was appointed Secretary of Health for the state of Washington in December 2020. Great timing. He came right at the last winter wave that we had for COVID-19, and his arrival into the state when we had another variant that was, impacting our lives. Before assuming his role, he was fighting on the front lines in Texas, where he was the executive director and local health authority for the Harris County Public Health in Texas, a national respected public health agencies for the nation's third largest county, serving nearly 5 million residents. Thank you so much to both of you for being with us today. I know you are incredibly busy. I'd like to hand over to Dr. Shah now, who will set the stage for today's event and guide us through our discussion around the topic, ending the pandemic and preparing for the next. Over to you, Dr. Shah.
This is always the hard part when you're the moderator. You're supposed to actually know when to unmute appropriately. So I apologize for not quite doing that task right up front successfully, but I will do my best moving forward. I just want to start by, Nikolai, thanking you and just for convening, and also for your continued partnership with PATH and the incredible work that PATH does, not just here in Washington, but across the globe, and really bringing health and innovation to the spectrum. So thank you so much for that kind introduction, and really appreciate the opportunity to help moderate this discussion. And I say help moderate because I do think it will be a nice free-flowing discussion amongst the three of us, and I really look forward to that. And Congresswoman Jayapal, thank you so much for taking time out of your extremely busy schedule. We know that you are doing so many amazing things for the state of Washington. I really just want to thank you for taking time out of your schedule, and I believe in the other Washington, if I have this correct, to join us this afternoon. And for you, obviously, it's this evening. And so we really appreciate the opportunity to have you today join us. So Nikolai and Congresswoman, thank you so much.
Thank you. Thank you both.
Well, with that, I really want to start by saying a few things and setting the stage, as Nikolai had just mentioned. And then really, I'm going to turn it over with some facilitated questions to our two esteemed colleagues. And then we will have some some Q&A through the chat function. And so we really want to invite you to be able to be a part of this discussion. And we'll be really doing that at the very conclusion of this conversation. It's going to go fast, so I'm going to try to do my best to get through this fast. But I will say, first of all, in addition to the real honor and the pleasure to be here with my two colleagues, I really want to thank our attendees who are tuning in today. This conversation comes at a critical time. We know that we are just coming off the Delta surge, not just in our state, but in our country. And if you look at the latest statistics and the latest information, Omicron has taken over the stage, if you will, with Delta. And now the vast majority of cases that are being identified in the continental United States, and especially in the state of Washington, are Omicron related. And that is a real significant challenge for all of us. But we do recognize where this was first characterized, not where it started, I want to make sure to be clear, but where it's first characterized in South Africa and Botswana. There was a real concern at that time of how quickly this would potentially be able to move across the spectrum. And we know that that has occurred very quickly. So this really reminds us now, as we are getting to the 2-year anniversary of COVID-19 being identified in the state of Washington, and the first case in the continental United States, the first outbreak, the first death, that we're now almost 2 years into this. And really in our state, but in our country, this has been an incredible journey that all of us have faced. There have been challenges, but at the same time, we also know that there have been incredible achievements. And we cannot say enough about having the ability to develop vaccines. That really has been such an incredible journey and an incredible step forward. But at the same time, we also have to figure out how to get those vaccines into the arms of people, because ultimately that is the success. Yet, the scientific achievements aside, the majority of people around the world, and a good, unfortunately, significant portion of people, even in the United States, still have not availed themselves of those vaccines. Across the globe, many do not have access to the innovations and also the even just the accessibility of vaccines that are needed to tackle this disease. When we were here maybe a year and a half ago, all our tools were masks and distancing and policies in the community. And now certainly it has changed to being where we are now with the addition of vaccines, and in the US, boosters, and all across the globe still recognizing that there has not been enough of that vaccine equity across the system, across the globe. That said, we know the failure to control the virus anywhere in the world threatens human health everywhere, and improving global access, regardless of status or income or other benefits of where people are to be able to access things and these therapeutics, these vaccines, these life-threatening, life-saving innovations will help against this life-threatening virus, and we really need to do everything we can to end this pandemic. When we don't have equitable access to diagnostics, treatment, and prevention tools, we just don't have the ability to make sure those policies and the systems approach of everybody working together can be as successful as possible. And that has been a real challenge, not just during this current Omicron variant wave, but also prior to that. So during our conversation today with both Nikolai and Congresswoman Jayapal, we're going to reflect on how we got here, how the world could have been better prepared for COVID-19, and what steps will be needed to end this pandemic and ensure we're better prepared for dealing with the future health crises that are upon us. If we believe this is the last time we will see an infectious disease that takes the world by storm, that is incorrect. We will likely see others. If we believe that COVID-19 is over, that we will also be not in the surprise to know that we're going to have a long tail to this, because it's going to continue to move forward for a long time coming. And so ultimately we have to think about how do we end this across the globe. So I thought we could start with a question for all of us. And, you know, I without necessarily pointing fingers, I do think it's important for us to know what we did that went well and what we did that didn't go so well as we have fought this pandemic. And really, even what has surprised the two of you, either positively or negatively, as we move forward with now 2 years into this pandemic. So let me start with Congresswoman Jayapal. What have we gotten right? What have we not gotten not so right? And how do we really look at this as we look back to where we've been?
Well, Dr. Shah, thank you so much, first of all, for your service to Washington State. We are so pleased and honored and thrilled that we have you. And we know that it is a rough journey, and you have been shepherding us and leading us with the governor's leadership as well to make sure that we weather this as best as we can. So very, very grateful. And Nikolai, you missed the most important part of my bio, which is that I worked for PATH. I can't believe it.
You say that. You should say that yourself.
I can't believe it. You missed that I worked for PATH for 5 years. So this is near and dear to my heart. So pleased to be with you as well. So on this question of, kind of what was done right and what was done, what could we do differently? I think globally, one of the things I've been surprised by is how helpful, or not surprised by, but inspired by, is how much I've been looking at what went well globally that we could learn from in the United States. So many things that were done right before and during the pandemic globally. Many places that were hard hit by the SARS epidemic decades ago, like Taiwan and South Korea, invested heavily in their public health capacity. They increased the number of hospital beds, they increased their public health monitoring systems, and it better prepared them to handle the COVID-19 pandemic. And sort of on the other side, in the United States, we have, as the federal government has disinvested from, sort of really the kinds of investments into state public health departments, it's been left to the states to really see whether or not they could come up with the resources to invest. Luckily, in Washington State, we have a strong public health system, much stronger than many, many other states, where really, if the federal government wasn't investing, the state said, I'm washing my hands off of this. And we haven't had that public health infrastructure in the same way. Another aspect that many countries got right in responding to the pandemic is they had some sort of a universal healthcare system. In countries with universal healthcare, especially those with single payer systems, people who got COVID didn't avoid testing or treatment out of fear of cost. A COVID test or treatment didn't come with the threat of a large medical bill. And the government system was actually able to put in place very quickly a lot of testing that was helpful to identifying the virus early on, and then making sure that people had the necessary treatments. Well, at that time, there were no treatments, but at least we're able to go into the necessary precautionary measures. And I think that is something that we still struggle with. In fact, I've been talking to the White House about it, just around the issue of tests, how complicated it is to make sure that we have low cost or no cost testing in this country that would really help us through this next wave that we're going through of Omicron and anything in the future that we might come up with. I think there's a certainty that universal healthcare offers during a global health emergency that's crucial to dealing with a pandemic. And another thing that happened here in the United States that we had to deal with was that people got kicked off of their healthcare insurance because they lost their jobs. So that direct connection between healthcare, somebody's healthcare, and somebody's job made it that much worse, because now we had even more, 19 million people that lost their jobs, and so they lost their healthcare. So I think those are some of the challenges we've had. But I think that what some of the things that we got right is we once we had a president who was actually acknowledging the virus, we did immediately move to making sure that we were getting shots in arms. The American Rescue Plan that we passed last year was absolutely crucial to that effort. It pushed federal dollars into state responses to making sure that we could get shots in arms, money in people's pockets, and that we could at least start to invest more in that public health infrastructure. Money for hospitals was absolutely crucial in those days when ICUs were getting overwhelmed and our hospital systems were getting overwhelmed. And so I think we were able to do a significant amount of investment last year that unfortunately, I think we're going to have to pick up and do a COVID supplemental for more funding this year, ideally in the first quarter, because we are still having to deal with a lot of the unpreparedness of our system. I also think we're starting to re-prep the emergency pandemic response, which unfortunately had been dismantled in the last administration. I think now there is at least a recognition that we need to have pandemic preparedness very, very clearly identified. This administration has done that, and we will invest in it. Very last thing I'll say is other countries like Germany put in place automatic stabilizers so that when an emergency happens, whether it's a health emergency or an economic emergency, the government automatically kicked in levels of funding and social safety net support services and health services and other things that people would need. And I am trying very hard with my Paycheck Recovery Act and a few other things I'm doing to do the same thing, where imagine if we had economic stabilizers where if the infection levels reach a certain level or unemployment reach a certain level, and even if it was cycling with waves of the virus, that those things would click in automatically, and we wouldn't need to go through a political process to answer an emergency or a crisis in the country. So I think those are some of the things we've learned and some of the things we're trying to improve on. But of course, we have made enormous progress in the last year with vaccines, with boosters, investing in vaccine technology early under the last administration, to be fair, was very, very important as well.
Congresswoman, thank you so much. That was a very comprehensive answer, and I'm very impressed by the breadth of it. And by the way, I reminded myself that I had said Jayapal and it should have been Jayapal, and I apologize to make sure that I have that correct. And so I want to make sure to pronounce your last name correctly. Apologies for that. But I did want to just make mention, as you say all these things, it just reminds us of this journey and how quickly we can forget where we were and how this unfolded and where we are obviously today. And so I just, as you go through all these things, and it I think a lot of us have, because we've lived it does feel like a bit of a post-traumatic stress of going through these 2 years. So thank you so much for underscoring that point, or these set of points. Let me turn to Nikolai. As you hear Congresswoman speak about what's been occurring across the country here, and even our work across the globe. You're leader of obviously a global NGO working in, what is it, over 70 countries? Do I have that correctly? That's a lot of terrain. How do you see the same question about the successes and even maybe the challenges over the last 2 years, and maybe from a more global perspective, if you could add that in?
Yeah. No, thanks. And also thanks, Congresswoman, for great points raised and very comprehensive response. Some of the same points I would say also internationally. I mean, the R&D effort, which was really driven by the US initiative, the success of the mRNA vaccines, the Moderna and the Pfizer. I mean, this is a completely new vaccine technology that basically we didn't know if it was going to be successful at 2 years back, and now we're seeing that it's the most effective and safe vaccines out there. That's quite remarkable, and it's not only remarkable for COVID, and also now with the potential of needing a specific Omicron variant of those vaccines, that they can be happening in 1 quarter. In 1 quarter, you can, change the recipe and have a new variant-proven vaccine ready. But also the perspectives of using those technologies, mRNA technology, for other diseases, that infectious diseases, other vaccines that we have had a hard time dealing with for decades. And I think that's probably the greatest promise that I have seen, and the greatest news from a scientific perspective. Also the willingness to to work together, private sector, public sector. We know that NIH was also critical in developing important know-how for the mRNA platform, and there was both a collaboration in the US, but also with European actors, global actors, and I think that's the scientists have really come together and sharing with each other without boundaries so that the world could respond quickly. In Washington State, I think as a newcomer to the state, I saw also some great things about public and private partnerships, how the state came together with actors, it was Microsoft, Starbucks, and others who helped actually provide their expertise in helping the state respond. And I think that trust between the public and private sector is really critical when you're dealing with a pandemic like this one. And it speaks a bit to what you mentioned, Congresswoman Jayapal, about the difference in health systems where you have also that maybe level of trust between the public sector and the population, and how following guidelines, how that is an important aspect of a response and the results of a response. In terms of frustrations, there of course, there are many. And what I could not mention this, but the health equity and the vaccine access obviously is the biggest failure, moral failure probably of this pandemic. The fact that we are still in single digits in places in Africa, and we have oversupply in many countries in the Western world and the Northern Hemisphere, it's not right. And it's also now we are paying the price for that with the Omicron variant, which, as you said, Dr. Shah, I mean, imagine this was outlaid in the end of November, and 2 to 3 days after, that variant began to show up in Europe, and the numbers were just going like this. Here we are 6 weeks later, and the cases are just going like this since end November. We don't know if better access to vaccines or equal access, if that could have prevented Omicron. We don't know, but we know that there is a higher likelihood if more people would be vaccinated around the world, that variants doesn't, grow and being transported to other parts of the world. So that is as a frustration and the lack of solidarity, nationalism that many countries around the world shown in the beginning on hoarding of vaccines was hard. There was good mechanisms put in place like COVAX, where you are sharing vaccines, but obviously that was not enough, and it relied a lot on the supply from India, which then had their own crisis to deal with, which shut down the supply of that vaccine technology and that. So I hope as we design the future response for the next pandemic that we would be able to do a better job in preventing this lack of access to happen again.
Thanks, Nikolai. And you've said a lot that I'd love to unpack, but I'm going to actually have, I have another question for Congresswoman, but I want to really get her thoughts and reactions to what you just said, and in particular about this real global vaccine equity piece. And all three of us share this real interest and even backgrounds in across the globe. And so here we are, for example, in the state of Washington or across the country, where we have these life-saving vaccines. They're safe, they're effective, they're available, they're free, they're right down the street from you, right? And yet we still have people who are not availing themselves of those vaccines. And yet you then go across the globe, across the borders, and you have, in other places where, and I don't mean to say this with too much color here, but would do anything to get their hands on a vaccine to protect themselves and their families. And there's a disconnect of what we're seeing in here and elsewhere, and other countries too, European Union, et cetera. And we're seeing a disconnect with other parts of the world. So, Congresswoman, as you hear Nikolai speak about this vaccine, global vaccine inequity, how do you see that and our approach to it? How should we be framing this?
No, I was just thinking that is exactly the right number one problem that we've had since this pandemic started. And it's of course reflective of other disparities, but we have to think about these issues, particularly in public health, across boundaries. And we cannot expect that in the United States, even if our mission was just to protect the United States, that you would be able to do that without making sure that there was vaccine equity around the globe. And of course, that's not all we care about. We care about the world's health. And so that is why I and Tom Malinowski and Raja Krishnamurthy co-founded and co-chair the Global Vaccine Caucus, along with some senators, Senator Markey and others in the Senate, because we immediately started, and through the Progressive Caucus, we actually pushed for the TRIPS waiver. So we pushed the United States to come out firmly for the TRIPS waivers so that we could license these vaccines around the globe, wherever there was capacity, and make sure that we could produce them in other countries. That is really critical. And President Biden did do that, but unfortunately it was blocked by some of our European allies. We haven't given up, but that is of course a longer term strategy. At the same time, Tom and Raja and I have been pushing for at least 20 billion to be put into quick domestic manufacture and production, specifically of vaccines here in the United States, but specifically to send to other countries. And I know that we have done a lot. The president always talks about how we are the country that has contributed the most of the vaccines to COVAX and elsewhere. But frankly, I think it's not enough. I think we have to do more. And we have to actually get to a scale that is going to make a difference. And it has to be, and from my work at PATH, I know it's not just about providing the technology or the shot. We also have to invest in the public health systems in those countries so that we can get the shots from shipment to the arm. And so that is also why I was able to champion and get into the appropriations budget. It hasn't passed yet. We still have to pass our appropriations bills, but another issuance of special drawing rights, which is essentially free money for these countries to be able to invest in their public health systems. There was already, I think it was 1.5 billion is what we pushed for. There was already a much lesser amount that in special drawing rights that was issued by the IMF with the United States push, but we need more because all of these countries, some of them, if you look at India, as we all know, that's a very different situation than some countries in Latin America or some countries in Africa. There isn't a network in some of these other countries, whereas India, of course, has a pretty strong public health network and even the capacity, just like South Africa, to manufacture vaccines. So we should be doing everything we can to decentralize the manufacture of vaccines, and the United States has to put a lot more money, and all of the wealthier countries have to put a lot more money in, because it is a crazy statistic that such a tiny percentage of vaccines are actually getting to the world's largest populations. I don't know exactly what the statistic is today, so I haven't quoted it, but I'm sure Nikolai knows and can tell us. But I think that's the work we have to do. And so we are pushing the Biden administration right now to put this money into the appropriations bill or into the Build Back Better Act or into whatever COVID supplemental is there, because we're not going to solve this problem if we think about the United States as being this, hermetically sealed place. We are not, number one. And number two, it is our moral responsibility, I believe, to make sure that everyone around the world is vaccinated. And we have a particular responsibility as one of the wealthiest countries in the world.
Well said, Congresswoman. And, I couldn't agree more. I think the other piece of this is really about, we talk a lot about vaccines and the actual vaccine itself, but we also recognize that there are so many social elements, what we call in public health, as you know, social determinants of health, housing and transportation, education, poverty, that really go into what's the real challenge of being able to, to get an understanding even of the importance of fighting the pandemic, not just about vaccines, but everything, wearing a mask, or, being distanced, or maybe not having going out in a certain setting because you might infect someone else. When you would look at all of these other social elements, and Congresswoman, back to you, Nicolai, I apologize. She's going to get two in a row here. Really, the question is, how do we prioritize, what oftentimes gets the attention, the headline is the vaccines or the therapeutics or the healthcare, but it's really about these social elements that really drive oftentimes, most of the time, the real outcomes of health and well-being. How do we prioritize in the midst of a pandemic, right? In the midst of a pandemic, how do we prioritize those social elements?
Well, Nicolai actually spoke to this as well in his answer earlier when he was talking about the racial disparities, right? When we're talking about equity, we have to look at all of these social determinants of health. And I think COVID really highlighted the large holes in our social supports here in the United States. And, whether that's housing and worker protections, people don't think of those as being connected to health, and yet they are absolutely intertwined with the effects of the pandemic. So housing, labor, racial equity, other factors, recognizing the interconnectedness of those factors with health is the first step. And in Congress, what we've done is I've been working very hard to make sure that all of our legislation, our COVID response legislation, all future legislation includes support for all of those aspects. So if you look at the American Rescue Plan that we passed and signed into law last year, that was so essential to getting our economy back, to getting shots in arms, to getting money in people's pockets. This was, it really embraced the overlap of those issues. And we did things like we increased the child tax credit. We increased the Supplemental Nutrition Access Program, SNAP. We provided support to homeowners and renters to stay in their homes. All of those things were fundamental. And the CTC alone, the child tax credit alone, has already cut child poverty in half and helped millions of Americans to deal with the non-medical harm of the pandemic. Sadly, that child tax credit, the last payment goes out next week, or actually this Friday. And so, we have work to do to make sure that these things continue, because you don't want to see a dramatic drop in child poverty and then the child tax credit goes away and you see this massive increase. That doesn't help us. We need to be consistent with these things. And, I think that there is a real opportunity for us to make the case across the board. In the United States, health itself has so many disparities. And the most vulnerable communities, Black, Brown, Indigenous communities, poor communities, rural communities, simply do not have the level of health access or health coverage that other places do. And so they're at a disadvantage to start with. And then you have a pandemic and the virus goes right to, and Dr. Shah, you've been dealing with this so incredibly for our state, but it goes right to those vulnerabilities. So the people that live in areas that have toxic pollution right by the highways are the ones who have asthma and respiratory problems, and COVID hit right there, went right to that. And so I don't think we can divorce who died and who was affected by COVID, the first strain, the second, and now the third, from what their living conditions were. And that's why Build Back Better, we're looking to invest in housing, rebuild our stock of housing, take on climate change, address childcare and all the other things that stop people from even staying home in the midst of a global pandemic and taking care of their health because they need to take care of their family. I get very passionate about this, so sorry, Nicolai, for the long answer.
No, that's great. That's great. I mean, we need passion, in this very challenging time. So really appreciate that additional set of comments. And, Nikolai, a question to you as you're hearing the Congresswoman speak about this. I'm going to shift to you in maybe in a different way. You said this earlier, and rightfully so. It was, I believe, it was November 26th, which was, the announcement or the identification, if you will, of Omicron, and it was November maybe 30th, if I remember correctly, where all of a sudden it was, CDC had made some comments about, okay, what are we doing here in the U.S. And then just a few days later in the state of Washington, we confirmed our first 3 cases. So very quickly, within about a week, maybe 8 days, we had something in one part of the world that was all the way over to where we live. So, as you think about this incredible spread of virus and disease, it strikes me that we then have the challenge of all of our usual ways of doing work, right? Innovations, technologies, global technology, but that takes time to develop. That takes time to get out the door. That has supply chain constraints and other issues. You're such a leader with Path. Can you describe this real dynamic of the speed of a pandemic and how quickly the virus spreads, with how do you reconcile that with the therapeutics or the innovations or the technologies or the other aspects of how do you respond to it globally when things are changing and evolving so quickly?
Yeah, that's the billion-dollar question, right? Because no one expected the speed of the pandemic. No one expected the speed of Omicron. I think that has been striking us all, how fast it went. It went also fast with Delta, but this one is really, really, really fast and very transmissible. And we were not prepared for that new wave, for sure. We thought we had turned the corner, and then suddenly a new variant arose, and supply chains, hospitals, healthcare workers, all were exhausted already. And now we have to deal with another significant wave on an already completely stressed out system and workers that has done all they can for the last 2 years to address this. So, but what this in overall, not just the Omicron, what COVID has taught us is the fragility of our global supply chains is really we're very fragile, and that goes for PPE, it goes for diagnostics, for testing, for vaccines, and we were relying on systems that we are using for normal vaccine production in India, as we talked about earlier. Those places where you manufactured vaccines, they were already on max capacity with dealing with normal vaccines for children. So we were already pretty fragile, and then this one comes on top. And it just shows that the pandemic preparedness aspect of this had not happened before. And I think we've learned a lot during this pandemic, and I think the US government, as well as Pramila spoke to as well, is that the discussion is changing now a bit, because it's not just about the science and the R&D anymore. It's not just about getting the products and procuring them and getting them over the border to a country, and then everything is going to happen by itself. It doesn't work like that, and we know that. Getting those shots into arms in the US is a challenge, but imagine doing that in a remote area of Congo or Uganda, or where there is no roads, there is no health workers, there is nothing, there is no supply chain, there are no refrigerators, no freezers to keep those vaccines cold. So the complexity as you roll out these vaccines is just at a magnitude that is so much more difficult than if we're doing it in the US. And that whole, from the R&D to the distribution to the supply chain, having health workers, having the information systems, the digital systems to actually tell the decision makers where are there outbreaks in this community or that community, how do we help here? That lack of information is also a factor that is making it difficult for us, because this is a vaccine. This is a pandemic that moves so fast that we have a hard time, coping with that speed. Yeah.
Yeah, well said. And I guess maybe one question, as we're thinking from the Department of Health standpoint in Washington State. So our charge obviously is the state of Washington and the people, Washingtonians, the people that live within the state. And we know everything we do has an impact across the system, whether it's across the country, across the globe even. And yet, one of the big challenges that we've had is really around misinformation and myths, rumors, disinformation, wrong information, inaccurate information. And we're constantly trying to address one thing. And then once you address that, you have a second thing, and then you address that, you have a third thing, and it's ever evolving. And yet I know what we put out, or what is put out in the state of Washington, not necessarily by us, but someone else, can have a reach all the way across the globe and even impact someone across the globe. How do you see this real, a lot of people have called it the infodemic, not just the pandemic. And how do you see that approach to and this is for both of you actually together, about how do we fight misinformation, which is really, I would argue, been the second part of this pandemic that has made it even harder to fight all the other aspects of the virus, is everything else that's been rumored about the virus and or the fight or the approach to how do you handle it. So how would you take the infodemic on? To Congressman, first to you.
Yeah, well, we're doing that in part by looking at the social media companies and their responsibility to control disinformation. This is a very difficult subject. I mean, I think that these companies have, they do a lot of good. We all use their products, but the reality is that their algorithms are actually built around clickbait and not truth. And so the more clicks you get, the more the algorithm promotes that. And that thing could be completely wrong. But if it gets people to click on it, that's what gets promoted. And so we have been talking about this in Congress, taking it on through antitrust law, through reforms of looking at what we need to reform in the communications laws to take on this disinformation and misinformation. But also remember that these even to create the public health systems of informing somebody, we have the great systems that we have now where you get notified, your exposure notification, they're linked between the public health systems and your phone. But remember that Apple and Google both fought that because they wanted to control the data. So when this first happened in Europe, they initially said, no, we're not gonna do this unless we have our systems set up so that we can use our algorithms and control our data. That was a big problem. Had we been able to immediately have government be the repository, because this is health data after all, and not have that fight about who controls the data, that would have been, I think, a big benefit. So there are a number of pieces of both the misinformation, but also the control of data that is monetizing this data, even for something like a pandemic. And the surveillance capitalism is the term that experts like Shoshana Zuboff use. And I think that that's something we have to take on as well, because we want the government to be the entity that manages the flow of information as it relates to public health. So I think it's a complicated question because we are so deep into that misinformation that pulling out of it requires a complete change of the algorithms. It requires a complete change of the way social media companies operate. And I think that's going to take regulation personally.
Yeah, well said. And Nikolai, your thoughts about the infodemic and how to tackle it globally?
I'm so glad you bring it up, because this is probably another area where we underestimated the impact of information and misinformation. because maybe we thought that with your own health, you would make the right decisions based on what is good for your health, and listen to credible sources of information and science-based information. And I think we have a role to play in making sure that everything we put out there is really evidence-based, it's fact-based, because these are important decisions for people to make with their own health. I want to take a slightly different angle to the way you responded, Congresswoman. So if we look outside of the US perspective, I think, and you mentioned it, the health system and the different countries. So the level of trust between the government and its citizens, and how is that social bond or social trust that you have? We're seeing some of the highest vaccine rates in for example, the Nordic countries where I'm from. And there is this huge trust in the government, and no, regardless of what political party you are representing, at least on the health side, there is really, really strong alignment on what is good for the citizens of the country, and that messaging is so aligned. So I think misinformation needs to be fought for sure, but it is also the result of the state of the country that we are in, right? And the situation we're in right now, which makes this a huge problem in some places. But if you look internationally, also in communities in Africa, I mean, it depends. People will listen to people they trust. They will listen to leaders that they trust, and they will follow them. And we need to do a better job, not only on the supply side, but also in the demand and the communication of why this is important. But great question, and I think it's a hard topic to discuss.
But Nikolai, I think that's a really important, sorry, do you mind if I?
No, please.
I think that's a really important point that you've raised. I totally agree with you. There is that trust in other countries, far more trust between the government and its citizens. And I think particularly in the health context, it goes back to one of the points I made at the very beginning, which is that the government has taken care of people's health, right? So in many countries where you have a universal healthcare system, the government is providing at least the means or the actual service of healthcare. And so the government is the expert on healthcare. Whereas here in the United States, we don't have that. And there's a lot of anger from people and mistrust around even pharmaceutical drugs, for example, because people pay so much for a drug that was actually developed with the government's benefit. I mean, you go back to the polio vaccine and you think about Jonas Salk, when he was asked why he didn't patent the polio vaccine, he responded that people own the discovery. And when the inventors of prescription insulin patented the drug, they sold the patent for $1 with one inventor claiming that insulin belongs to the world and not me. And yet now you think about how much we pay for insulin and how people have to drive across the border to Canada to pay 10 times less than what you pay in the United States. I think that is part of what has created this mistrust. So I actually completely agree with you. And I think that is part of what's broken down, is we have a healthcare system in this country where people feel like the government has not been the arbiter or the provider or the communicator of healthcare, even though we have very strong federal agencies like the NIH and the CDC and others.
Yeah, it's interesting. I penned an op-ed in the Seattle Times this last week that was really about hope and the path forward. But what I also described in there as being a 20 years ED physician in a VA hospital system taking care of our nation's veterans back in Houston, and really describing the incredible amount of spirit by which our veterans would approach their own medical care while laying in a bed with a very difficult, whether it was a traumatic experience of a car accident or a heart attack, and yet so many of them, not only did they provide us with grace and the spirit to keep moving as healthcare providers when we were ourselves challenged, but it was interesting. There was never this question about Mr. Johnson, I'm going to give you IV blood pressure medicine to get your blood pressure down. And someone say, well, gosh, I read on the internet that, doing that IV in the ER is not the way to go. And doc, I'm not going to listen. I'm not going to do it. And that's exactly what we're seeing in this pandemic. And so, it is really, really hard to get people to break through that noise of everything else that's going on when we're really trying to get back to that individual health decision that ultimately trust is the currency there. So thank you to both of you for those very thoughtful responses. Congresswoman, I'm looking at the chat as well, and I've been trying to incorporate some of these questions in there. So some of them I've already been asking, but I did want to focus. There was a question about the appropriations and some of the, the real interest in what we and as leaders can do. And you're obviously a congresswoman, so you have the the highest level from the two of us. We're Nikolai and I are small potatoes here.
Oh, I don't think so.
So we ask you, there's a question about appropriations and really how to support some of what's in Congress. So let me put that forth to you as far as what you think we can do moving forward.
Well, I think really continuing to build the movement for people speaking out, testifying before Congress, writing letters to your Congress member. If it's me, thank you. If it's not me, you probably need to look across the country and try to mobilize people in districts to say to your member of Congress, it's really important that we get in this 19 billion for global vaccine equity that we are trying to get into this next budget. It's really important that we get in the 1.5 trillion of special drawing rights, because that's what helps these countries develop their own public health systems. It's really important that the United States continue to push for the TRIPS waiver. That is actually with the administration, that is not a congressional function. We have asked they have already come out for the TRIPS waiver, but we've asked them to, and perhaps with the change in government in Germany, there's an opportunity, a new opportunity. That's a longer term thing, but that's what allows us to develop, for countries to develop the ability to manufacture these vaccines in their own countries, so they're not dependent on a Western country to manufacture. So I think getting engaged with your member of Congress is really important, and sending letters, making phone calls, and doing it right away, because we are trying to get these into the appropriations budgets upcoming. And there's a number of bills as well that we would love your help with, but the Global Vaccine Caucus has made these our priorities in terms of funding.
Thank you, Congresswoman, and well said. And hopefully people will avail themselves of how they can be a part of the process. So thank you for that. We're short on time now. We just have a few minutes left, but I did want to ask this question about hope. There was a question that was in the chat around the inspiration to MPH students and the future. And the three of us, oftentimes we're mired in today. We're mired in what's happening today and responding to Omicron or today's news or tomorrow and this and that. But how do we really look beyond? Are the two, first simple question is, are you two as hopeful and optimistic for the future as I am? So that's a one question. So that's a quick yes or no. So Congresswoman, yes?
Yes.
Hopeful?
Yes, hopeful.
Nikolai?
Yes.
Nikolai? Okay, so we have hope. How do you engender that hope and optimism and inspiration to the next generation that are seeing, people fighting and, arguing and, misinformation and information out there just about, is this really how we should do this? And, my own daughter, who's now 12, and, I've got two sons who are 7 and 5, and, the 12-year-old herself is looking at social media and asking questions. What's the inspiration? Is there, where do we, how would you like to leave it with the next generation related to this pandemic and beyond?
Nikolai, you go first. Give us hope.
Yeah, well, I have 3 daughters also, and they are 14 and 10 and 7, and I try to keep them fact-based as much as I can and help guide them. But I do think that we've learned a lot during this pandemic. We learned more than we wanted to learn probably. And we know what we have not done well, and we know what we need to do better for the next pandemic. I think there is hope in the leadership of the United States as well to taking some of those critical aspects of health system strengthening around the world, public health as a global priority, also in support of the US national health security and national security, because we see this is going across borders. So I think there is a change in argument, and also on bipartisan, that we have, there is some consensus on the importance of a global role for the United States to prepare the world better, and through the leadership that you can provide, give us hope that we can prevent the next one or do a little bit of a better job by having a more holistic approach to how we respond to a pandemic.
Thank you, Nicolai. Yeah, Congresswoman.
Yeah, well, first of all, I'm hopeful because there are leaders like you, both here in our state, in our world, and all the people that are listening are all, part of that hope, that belief that we can together make a difference and make things better. And I'm just reminded of, in the Book of Joy, it's a conversation between just recently passed our hero, Archbishop Desmond Tutu, and His Holiness the Dalai Lama, who I've had the opportunity to meet with multiple times, and is just an amazing, amazing human being. And in it, Archbishop Tutu says he talks about the difference between hope and optimism. And he says, optimism is ephemeral. It's temporal. It can move into pessimism. From day to day, you may feel optimistic, you may feel pessimistic, but hope is unshakable. It's as close as it can be to an unshakable belief in what is possible for the world. And that core grounding of hope is what I hang on to every day, because when I think about things that I never thought were possible, from a 16-year-old immigrant from India coming to the United States with nothing in her pockets, alone by herself to go to college, becoming the first Indian American congresswoman in the House of Representatives, and being able to work on global vaccine equity, I feel like we are changing the way these decisions are made. We are changing who makes these decisions. And we are doing it with people around the world who know that ultimately the only way that we are all better off is if we're all better off. And that takes all of us. And so that gives me hope. And to your kids, it's the young people who get this. They get the interconnectedness, they get social determinants of health, they get the, intersections between race, gender, and class. And that is always incredibly hopeful to me.
Well, I'm inspired now. I want to go change the world. This is great, Congressman. Thank you so much.
You already are, Dr. Shah. I don't know if you've realized that, but you already are.
Thank you. You're so inspirational. And both of you are. And I just want to say thank you. I know we're right at time, but I wanted to give each of you just quick 30 seconds. If there's any final message you want to give to the viewers of this webinar, is there anything you want to say? Let me start with Nicolai, and then I'll end with Congresswoman.
Yeah, I think this has been a fascinating conversation across Washington State, US, internationally, and there are so many parallels to what we do in each of our jobs. And I feel like we could have gone on for a couple of hours, and I hope the audience also found this interesting. So I just want to say, thank you to both of you for being part, and I hope to do it again at another time. But thank you for your leadership as well in Congress, but also in the state here, Dr. Shah. I think you're doing an amazing job. And I'm glad of the things we discussed here. They are complicated things, but we have our opinions, our viewpoints, and we are trying to do better for this response, but also for the next one. And that's it's hard to deal with a pandemic like COVID with variants coming every quarter. So we're doing our best, all of us, and that gives me hope as well.
Thank you, Nikolai. Congresswoman?
Well, I want to just start by thanking Nikolai, first of all, and Path for making this happen. It was the best part of my day. I really loved being with you both and talking about global health and COVID and how the United States can be a better leader. I think we're trying to do everything we can for that. And I think just to everyone who's listening, I also just want to say thank you, because this has been such a tough time around the world. People have lost loved ones. They have been living in isolation, fear, insecurity. And sometimes I say that being human is a courageous act. And I think it is. It's a courageous act to be human and to be engaged. And by being on this webinar, by doing whatever it is you're doing around the world, around the country, around the state, you are performing a courageous act of continuing to work towards a better world. So thank you. And Dr. Shah, I'm sorry, I had to say thank you to you, because you are our master of public health here in the state. And I cannot imagine how difficult things have been. And the moment that you came in to this moment, you are making us all so proud with your service, with your knowledge, with your competence, and with your compassion. So thank you so much.
Well, that was unexpected, but thank you so much, Congresswoman. I really appreciate that. Really appreciate the inspiration. And Nikolai, I want to echo what Congresswoman said about you and Path and hosting and really having us here. It is so incredibly heartwarming. You know, when we see all the negativity out there, to have three of us be able to come together and inspire each other, inspire others, I think is so critically important. I always remember the Will Smith movie, Independence Day. I watched that a lot with my kids, although there was a bad scene where somebody does something to Houston, and then my kids, my youngest said, wait a minute, did something happen to Houston? That's where our family is. And I said, oh, I better give context here. But if you remember that movie, it was really about the entire world coming together and fighting a common enemy, the aliens. And that's really what we're doing here, is fighting a common enemy, the virus. And unfortunately, at times, it appears we're fighting each other. And I hope we can find inspiration to how do we continue to focus on the virus and not each other. So I just want to say thank you to both of you. Wow, this is great. Thank you to our audience. Thank you to the individuals that put the questions in the chat and their comments. And we'll certainly continue to share those with all of us here. And I just want to say again, we will do this hopefully sometime sooner than later, and maybe we'll do it in person because it's safe to do so. I really want to say thank you again. So thank you everybody for listening, and we are adjourned.
Thank you. Goodbye.
Thank you. Bye-bye.
Bye.